I'm Dr. Thompson Akwo, the Chief Editor of Health and Development Magazine, and we're at the Baltimore Convention Center this Wednesday, the 8th of March 2017. We are part of the National Facilities Management and Technology Conference and Expo, and with me is
Jeff Light.
Thank you, Jeff Light. You did a presentation today on the involvement of
aging infrastructure and kind of what are those best practices.
Aging infrastructure and best practices in the hospital care industry, right?
Right, very specific to healthcare, and given a lot of hospitals are pretty old, so what are best practices of getting one renewal, but also how do you prioritize those?
There are lots of people who specialize in health facility management and technology. Why should their own cases be looked differently, and why should they have a different section like they're having maybe for the first time during this conference?
One is healthcare is different. They're dealing with people's lives and making a difference. It's also a major part of the GDP. So when you start looking at how money is spent throughout the country, it's one of the major avenues for how money is spent. And then lastly is people all are impacted by healthcare. So it's not hard to talk to somebody, and it's either they personally or someone else has been in a hospital or health system in probably the last year.
There are lots of people who may not understand what are the requirements in order for you to have maybe a facilities manager position in a multi-tier healthcare or hospital system like in Texas, where we have the Texas Medical Center in Houston, the biggest in the world. So what will be the basic requirements for you to have a management position in a healthcare facility in a system like that?
So that's a great point. So one is understanding the codes and the regulations. Healthcare has very specific ones that are aligned with the Center for Medicaid and Medicare. So that's one, understanding that. Many organizations have gone through joint commission, so it's So then the other point is understanding the risk, and more importantly, understanding how it impacts the patient at the end of the day. So good customer service, good listening skills are vital in any management job, but especially in healthcare.
You finally, or you finish your presentation by giving a summary of what you did. And can you, in a nutshell, also summarize for the benefit of our audience and viewers who were not able to make it here, what was the focus of your presentation?
Sure. One change is evident in healthcare. The Affordable Care Act is probably going to change. No one knows how, but you still have to move forward. 80% of all decisions are made by a decision maker now, or a VP. So in consideration of that, your recommendations or your proposals have to align with your business goals. That's the first thing. Secondly, it's speaking in the language of the customer. So it's not being technical, it's being, again, aligning in a business sense. So what is a recommendation? How does it directly impact it? Thirdly is, how are you going to pay for it? You have to come up with ideas for how you're going to pay for these things. And cash is not always the only method. If you have good credit, you might want to look at financing other options. Then fourthly is, how does it align to your both. There's multiple committees that you're having to deal with today. So it's doing it in 1 or 2 pages. You don't have to get technical. It's aligning for what's the business impact, both financial, and what are those other things like sustainability or risk or safety and such.
Thank you very much. Today there are many people who are really desirous of moving from the facilities management position to maybe the C-suite, or what they call the chief executive job. And why not, since there are a number of facilities managers who have an MBA, some of them are architects. But we discussed yesterday, and it was said there is none who has ever been a CEO of one of the Fortune 500 companies. How can, in your experience, how would you advise those who are managers of facilities to work themselves into being one of the bosses of these companies we talked about?
So, great point. So one, education's vital to start with. You have to not just have a bachelor's, you have to have a master's, most likely a master's in healthcare administration or MBA. Secondly, probably being a fellow of the American College of Healthcare Execs. So getting involved in the ACHA, not just ASHE, but now where the executives are at. So the American College of Healthcare Execs, and through your work there, becoming a fellow. So one, it's understanding the language and how it aligns. And a lot of times it's starting small. It's a smaller organization, taking on those roles and responsibilities and being successful at it.
And finally, the relationship between health facilities management and the American Hospital Association.
So the American Hospital Association is obviously oversees all the various hospitals. It's a membership setting. So facilities managers are obviously part of it. Through ASHE is the American Society for Healthcare Engineers. That's one of the offshoots of it. We're both getting involved in their committees, but also seeing what, one, join, get involved in their committees, and also participate, giving your feedback, because they're looking for people, and that's one of the great ways of also networking. Networking is probably the best method for getting a new job or things that will excite you.
What would you propose, or what would you tell your colleagues who are out there who are healthcare facility managers about the importance of attending this meeting, especially those who have never been part of this meeting before?
Network. So one, it's the people, but more importantly, it's also, you have to broaden yourself. It's not within your own organization. You have to see what others are doing and what are the technologies and what are the ways that you can, again, represent yourself and improve yourself within your organization. So that's why, again, it's not just reading a book and just dealing with your own organization.
Thank you very much.
My pleasure.